On behalf of my team, I would like to introduce you to our chairperson, Dr. Ranjit Guha. Dr. Ranjit Guha, Dean, Students' Welfare, Principal and Professor of Anatomy, Indira Gandhi Institute of Medical Science. Dr. Ranjit Guha has completed his MBBS in 1991 and MS Anatomy in 1997 from University of Calcutta and was a university topper and recipient of many honors, distinctions, and several gold medals. He has 27 years of teaching and research experience in anatomy and is the youngest PG medical teacher and Senate member, Faculty of Medicine in the history of Calcutta University. Dr. Ranjit Guha has worked in various academic and administrative capacities in reputed and premier national and international medical institutes. He is also the associate editor of NGCA and managing editor of KUMJ, JCMS, and JIGIMS. He has contributed his expertise in more than 150 journal articles and book chapters in nearly 10 books indexed in PubMed and ScopeMed. He is also the premier peer reviewer for JSI, NMCJ, KUMJ, JCMS, JIGMS, ARI, IGAE, and IJOSR, and shares his research interest in neuroanatomy, genetics, and MET. He is the National Resource Faculty for MET, nominated by NMC. Apart from delivering several award-winning lectures and orations at national and international forums, he has been a speaker for memory and its anatomical substrates at Illinois, Chicago in the year 2015, and speaker for yoga and its impact in medical sciences at KUMS Kathmandu in the year 2016. He is the member of many national and international learned bodies and societies and is current Vice President and ex-General Secretary of Anatomical Society of India and life member of Anatomical Society of India, Indian Medical Association, Society of Free Radical Research, and Association of Surgeons of India. So I welcome you, Dr. Ranjit Guha, and I would request you to further introduce to our chief guest and the eminent speaker. Over to you, Dr. Ranjit Guha.
Thank you, Remia, and I really want to congratulate at the very outset the Walter Close team for tagging IGMS and giving us the opportunity for presenting this webinar on the overview of COVID-19 and Omicron, which is really a pertinent topic at this trying time. And I feel immensely honored, humbled, and privileged to introduce today's chief guest, who is presently our Director cum Vice Chancellor of Indira Gandhi Institute of Medical Sciences, Professor Dr. Yanar Vishwas, a stalwart in his field and an iconic figure in his fraternity and an idol for his successors. Professor Yanar Vishwas is a very eminent clinical pharmacologist of international repute, basically being a faculty of AIIMS New Delhi. He is currently on deputation working as Director cum Vice Chancellor in Indira Gandhi Institute of Medical Sciences. And since his joining in 2014, he has brought a revolution in the evolution of IGIMS. IGIMS has developed by leaps and bounds, stupendously and fabulously, in a fantastic speed, through the activities of Professor Dr. Yanar Vishwas. And under his visionary and dynamic leadership, IGIMS has witnessed a real turnover and turnaround, rather, into a tertiary premier referral hospital with all super specialty services. Actually, Professor Vishwas is a very renowned personality and the entire nation, and he is known for his dedication, commitment, hard working, and sincerity. He has worked in many capacities. He has got lots of publications, a host of publications in very reputed international peer-reviewed indexed journals, and he has authored also a number of books, and he has delivered many award-winning presentations and delivered many orations, and is also a very renowned person in the entire state of Bihar, presently because of its enormous contribution in the development of our institute. And during the trying time of this COVID-19, our entire team of IGMS, all the staffs, they have shown their steadfast commitment under the leadership of our director, Professor N.R. Vishwas, be it in the field of RT-PCR investigation, next generation sequencing, be it in the field of clinical care at its best, and be it in the field of the catering largest population for COVID vaccination. So, in fact, Professor N.R. Vishwas has got enormous contribution for bringing IGMS to the national forefront. And that's why I really congratulate, I really thank Professor Vishwas for accepting our invitation of becoming the chief guest of this webinar. So, with these few words, I welcome our chief guest, Honorable Director and Vice Chancellor IGIMS, Professor Dr. N.R. Vishwas, and I will request Sir for his introductory and welcome address and comments, for his blessings. Over to you, sir.
Thank you, Professor Guha, for your nice introduction and very good words. And of course, particularly Mr. Jagdeep and Ms. Lab and other organizing persons for organizing this webinar, overview of COVID-19 Omicron, which is very pertinent, certainly. I, on behalf of IGMS family and on my own behalf, I congratulate the organizers, the participants of the webinar, and of course the speakers, who are none other than own Principal Dr. Ranjit Guha, as just now you have heard him, Professor Namrata Kumari. She is the HOD of Microbiology and who had spearheaded the Genome Sequencing Lab here at IGMS, first time in Bihar. And I am very happy to announce that in the last lot of tests, out of 40 samples, all are Omicron. Of course, both B1 and B2 varieties. Those are of scientific content. And then Professor Manish Shankar, who is our head of pulmonary medicine, who will speak on clinical features of Omicron and its management, as well as Professor Sanjay Kumar, who is the HOD of community medicine, who will speak on the preventive aspects. And I wish them best of luck and the grand success of this webinar. In fact, this corona pandemic is a serious threat to the whole mankind in this century. And started with the first wave, and you see, I am the first victim here of IGMS. And I was admitted in hospital in IGIMS Patna for 10 days. And that time we didn't have that facility of genome sequencing, and we don't know what variety it was, alpha, beta, delta, whatever. And then came the second day, the very serious part of this pandemic, but with a lot of reports by the vaccination and the corona behavior and other treatments. So, but still we have lost many of our citizens. And finally, though it is not very fatal but very contagious, this third wave, that Omicron. And we hope this is the last of this rate, and there should not be any fourth wave. And I will not take much of your time because the experts are waiting to speak their talk. And now I hand over the mic to the eminent speakers. Best of luck. Thank you.
Thank you, sir, for your blessings. So, with your blessings, can we start, Ms. Remia?
Yes, you can carry on.
Yes, yes.
Okay, so I invite our first speaker, who is none other than our own HOD Microbiology, Professor Dr. Namrata Kumari. And she played a pivotal role in performing highest number of RT-PCR tests during the trying time of COVID-19 and even during Omicron SARS. She is not only nodal officer of COVID-19 of the state of Bihar, but of IGIMS also, and she is also in charge of next generation sequencing lab, NGS lab, and she will tell details about it in her lecture. And she, along with her entire crew, they did wonderful job. And because more you test, more we can track, and more we can treat, and that is the formula. So that's why testing is very, very important. And Dr. Namrata and her team, they did the thing. They did the RT-PCR and many other advanced methods. They did the RAT also, and then TrueNat and CVNet and all these things they are continuously doing. And the feather in the cap added is the NGS. IGM has become a member of the INSACOG, the consortium, and the ISGL lab is there. So we are also ISGL lab now in the whole India, out of very few. So she is in charge of that. So she will tell in a lecture in details about all these things. So with these few words, I invite Professor Dr. Namrata Kumari ma'am to deliver her lecture. Over to you, ma'am.
Good afternoon, Director Sir, Principal Sir, my colleague speakers, the Walter Kluwer team, and dear audience. Thank you for giving me the opportunity to speak on such a prestigious Walter Kluwer platform.
You can share your slides, ma'am.
Yeah. Please share my slides.
I'm already giving the presenting rights, ma'am. You can share your slides.
Okay. Okay. So, since November 2021, last week, a new variant of SARS-CoV-2 has come into picture. That is Omicron. It created a lot of panic. But its entry has introduced the magic of a new molecular technology, that is next generation sequencing. Like RT-PCR has become a buzzword these days, even the layman, they are using this word. And similarly, NGS also is becoming very popular. In fact, NGS is the power these days. It can detect variant and it can give insight to the efficacy of a particular vaccine. It has so many roles and it can help in policy making at local as well as global level. And These days, many portals are being created and the data of NGS testing is being uploaded over there. And so we are able to fight this pandemic collectively. I have organized my talk under these headings, starting from overview of SARS-CoV-2 to the variants of SARS-CoV-2 and role of NGS. First of all, I would like to give you an overview of COVID-19. These are few important dates, out of which 11th March 2020 is the most important one, when WHO declared this pandemic as a global pandemic, this outbreak as a global pandemic. As we all know that this pandemic is caused by SARS-CoV-2 virus. The name SARS-CoV-2 has been given to this virus. It comes under beta coronavirus genus along with sisters SARS-CoV and MERS-CoV. The family is Coronaviridae and the subfamily is Coronavirinae. Now this is the schematic diagram of the virus along with the SARS-CoV-2 genome. Here you can see that this SARS-CoV-2, it is a medium-sized virus along with the largest RNA genome, which is encased in the nucleocapsid of the virus, along with so many proteins over it. All these proteins, they help in the viral replication. This is the genome of the virus. This part encodes the structural proteins like spike protein, matrix protein, envelope protein, nucleocapsid protein, and heme agglutinin in some of the cases. This part is representing the non-structural proteins, encoding of non-structural proteins. The spike protein is important because this spike protein, this has got many portions, and it is important because it gets attached to the human cell receptors. These are ACE2 receptors which are present in so many places of the body. Now with the spike of the virus, it attaches, RBD portion attaches to the ACE2 receptor of the human cell, and all these proteins, the proteins of the virus, they take part, and the permeability of the cell increases and the virus replicates and it is able to produce the disease. This SARS-CoV-2, it is 10 to 20 times more strongly it binds to the receptors as compared to SARS-CoV. Regarding transmission of the virus, as we all know that it is transmitted by respiratory droplets, and the smaller droplets, they are known as aerosol or droplet nuclei, which is airborne. Along with that, hand to mucous membrane contact is also able to transmit the virus. Fecal-oral route has also been proposed. The picture is demonstrating the three main transmission routes of the virus: the droplet nuclei, the droplets, and the skin to mucous membrane contact. Regarding symptoms and the disease course, Fever is the most important cause, and 15 to 20% of the cases develop severe dyspnea, which need hospitalization and supportive care along with oxygen support. And out of those hospitalized patients, 1/3 ultimately need ICU care, and up to half they need intubation. Cytokine storm and multi-organ failure, we already know, and the myocarditis and cardiac shock is the late complication of the viral infection. Certain comorbidities, these accelerate the viral infection. The current situation as on 5th February, India makes 10.68% of cases, global cases, and Bihar makes 1.96% of the India cases. Regarding death by COVID, India makes 8.72% of the cases, and Bihar makes 2.43% of the deaths from India. Regarding laboratory diagnosis, there are two types of tests available for the virus detection. Not only virus, actually two types of laboratory tests are available. One detects the infection and another detects the immune response. As we all know that infection detection is done by RT-PCR or other methods of NAT, and COVID-19 viral antigen detection, that is done by rapid rat test. And the immune response is detected by detecting the IgM, IgG or IgA antibodies. So these are serological testing, immune response, and this side you collect the sample, oropharyngeal, nasopharyngeal samples, etc. This is the schematic diagram showing the RT-PCR. Different steps of RT-PCR. Here you can see the antibody detection, serological antibody tests. Regarding trend of PCR positive percentage at IGIMS, all these three circles, they depict the three waves. As you can see here, the first wave was of the longest duration and the positivity also was very high. In the second wave, it was of relatively lesser duration. But here the plateau was disturbing or troubling. And the third wave is the smallest wave. Here again, the positivity percentage in the last month in January, it has almost touched the baseline. Now the variants. As we all know, as we all have come across so many variants of the SARS-CoV-2. A variant is a viral genome that may contain one or more mutations which may cause change in the characteristic of the virus. Now, when the characteristic of the virus is predicted, change in characteristic of the virus is predicted, like change in characteristics like transmissibility or the disease severity or immune escape, diagnostics and therapeutic escapes, then and when it is very much prevalent in the community, like many cases are being observed or clusters are being observed, and the community transmission has happened and the change in characteristics has been predicted. This is known as, this type of variant is known as variant of interest. Means variant of interest, till now it has not created any problem to the community, but the risk is there, emerging risk is there to global public health. Now, variant of concern is when the variant meets all the criteria of variant of interest, but it has started being associated with one or more of the following changes at the degree of global public health significance, like increase in transmissibility or increase in virulence or decrease in effectiveness of public health and social measures. So WHO has kept these variants under variant of concern category. WHO has labeled some of the variants as variant of concern and some of the variants as variant of interest. And variant of concerns are alpha, beta, gamma, delta, and Omicron these days. The Pango lineage and next strain clade lineage, these are the nomenclature systems. Omicron first outbreak occurred in South Africa. Omicron has been designated a variant of concern based on the preliminary evidence of a detrimental changes in COVID-19 epidemiology. This variant has a large number of mutations in the virus and especially on its spike proteins. More than 30 mutations have been observed on the spike protein. Now it becomes important because many of the vaccines, they target the spike proteins. So this initially the scientists or the scientific community was very much worried whether this variant will escape the vaccine immune system. But now this has proved that it is the vaccines are effective even against the Omicron virus, because in this virus not only spike mutations are there, but certain other mutations are also there. Now the current knowledge about Omicron, transmissibility of this variant is very high. This has been proved. But reinfection part, the information is limited. Regarding detection of this type of infection, the diagnostic tests, which are including PCR and antigen detection tests, they continue to detect the infection with Omicron, though some of the cases might escape. Corticosteroids and anti-interleukin 6, these treatment, as they don't target the spike protein, are still effective for managing the patients with severe COVID-19 infections. So while characteristics of Omicron are being studied, evidence shows that COVID-19 vaccines are still effective to protect against severe disease due to current circulating SARS-CoV variants, including Delta. So now the question was that do routine COVID-19 tests detect Omicron, Delta or other variants? So COVID-19 tests till date, like RT-PCR and antigen tests, they detect the virus broadly and not the specific variants. So if the antigen diagnostic test is based on multiple target kits, it will detect the COVID infection. And similarly, the RT-PCR test, many genes we are detecting by RT-PCR. So spike gene target failure, this gives a clue. And finally, those strains are kept for NGS to detect the variants. Now, many kits have been developed all over the world, including Omicron from Tata Medical and Diagnostics. ICMR has approved it, and the principle of the this RT-PCR based kit is that first target is based on S gene dropout or S gene target failure, and the second target is based on S gene mutation amplification. Genome sequencing is done for sentinel surveillance of the virus, and it is at present it is the most accurate method to track its variants. Now, how researchers identify Omicron and other COVID variants? The researchers sequence DNA to determine the order of 4 chemical building blocks that make up a DNA, that is adenine, thymine, cytosine, and guanine. The founding methodology is Sanger sequencing, which involves cutting up of the DNA into fragments and adding with radioactive or fluorescent tags to identify each nucleotide. But the limitation of this methodology is that it can sequence a smaller base pairs at a time. So it is time taking. And since 1990, next generation sequencing has revolutionized the area. Next generation sequencing sequences thousands to billions of DNA molecules simultaneously. So it does lot of time saving. The rapid detection of Omicron worldwide demonstrated the power of robust genomic surveillance and value of sharing these genomic data across the globe, as we already know all these things. Now, the Sanger sequencer versus next generation sequencing. The human genome contains 3 into 10 to the power 9 base pair. 1 billion base pair is the length of the human genome. And capacity of Sanger sequencer is approximately 1000 base pair. So you can understand that how many runs we will take to run this big genome. But NGS these days has the remedy, and it can handle the large sequences. Now, 2 types of NGS platforms are there: second generation technologies and the third generation technologies. The NGS in second generation, where the DNA is cut up into fragments and short stretches of genetic materials known as adapters are tagged on the ends of the fragments. And then a number of reactions are being run, and finally the amplifications are done of the required sequence. But in the third generation technology, it directly sequences long DNA molecules by passing the entire DNA molecule through an electrical pore in the sequencer. And nanopore is the technology. It has been developed by Oxford Nanopore technology. Because each pair of nucleotides disrupts the electrical current in a particular way, the sequencer can read these changes and upload them directly onto the computer. In the second generation technologies, the DNA is fragmented and sequencing is done. Then again reassembling is done. And all these things are done in a computer. So it is a bit cumbersome sort of method. But here directly the long DNA without fragmentation is uploaded. Final data is uploaded onto the computer. Now, the applications of next generation sequencing, these are certain other applications, and besides these, many more applications are there. Besides whole genome sequencing of bacteria, virus, human genome, it is used in transcriptome sequencing, in metagenomics, in agriculture, Means wherever there is genome, next generation sequencing is applicable. Personalized medicine, where individual genetic profile individual genetic profile guides the prevention, treatment, or the diagnostic aspects of that particular individual. It helps in drug target identification and drug effect and clinical molecular diagnosis of infectious diseases, inherited diseases, and in cancers. Now, the genome sequencing protocol, this is actually in nutshell, it has got 3 main steps. The RNA is extracted, complementary DNA is formed, this complementary DNA is fragmented, library is prepared, after library cluster generation is done, and these clusters are sequenced. The sequenced data is stored in the server, and the bioinformatics analysis is done. That bioinformatics analysis, the various identification, worldwide identified, recognized identification servers are there, like Pangolin server, NextTrain server. So these servers are, and many more, so many other servers are also available. These servers, they do the analysis, and some repository servers are also available, like GISED and NCBI virus, and certain other worldwide available open access servers are available. So all these data can be uploaded there, and anybody can access those data. Thereby, it helps in policy making or in certain other ways at the global. It can help in at global level also. So finally, the protocol is library preparation, sequencing, and data analysis. So these are the identification servers: Pangolin server and NextTrain Clade server. GISED, it was the full form of GISED is Global Initiative on Sharing Avian Influenza Data. It was started in 2008, and the database has become the world's largest repository for SARS-CoV-2 sequences. Next generation sequencing started in Bihar from April 21, when the selected samples with CT value less than 25 and 5% of the positive samples were being sent to Bhubaneswar, Kolkata, or Delhi. In most of the cases, Delta was detected. This is the genomics starting of Genomics Laboratory in IGIMS. The positive RT-PCR positive cases are library prepared, less than 20, of course, less than 25 CT value, library prepared. Cluster generation and sequencing occurs in the machine. This is, we are having MySeq Illumina platform. Here it is being monitored, and then the data, a huge data, is being uploaded into the server, and finally it is identified by the experts, bioinformatics experts, and variant is identified. In this picture, Honorable CM visited our Molecular Genomics Lab. INSACOG, Indian SARS-CoV-2 Genomics Consortium, included IGIMS as IGSL, INSACOG Genome Sequencing Laboratories in August 21. After establishment of the Genomics Lab, the first project handled was whole genome sequencing of carbapenem-resistant bacteria. When need arose, we performed two trial runs in June-July months. INSACOG recognized us and made us IGSL. We performed 2 fresh runs, and now IGSL IGIMS Lab is well established to tackle challenges of future. In IGIMS, this is the only functioning lab in Bihar and Jharkhand. The data of the sequencing is uploaded onto IHIP portal. This picture is showing this is the Omicron variant representation. This approximately 70% of the till date the data, 70% of the data is Omicron variety. This is about the Delta sequenced counts, Asia counts, India counts, though Bihar representation is less at present. Regarding Omicron, this is the Pangolin nomenclature is B.1.1.529. It was first detected in South Africa and Botswana, and it was declared as variant of concern on 26th November 21. It has 3 sublineages, BA.1, BA.2 and BA.3. BA.3 has not been detected in our country, and at present BA.2 is the most common sublineage all over the country. Its high transmissibility has been established. As per December 21 data, only 5.4% of the cases were Omicron. And in January, though the data is small, but it is representative data, and in January, 93% of the cases were Omicron. This is GISED data about the Asia, India and Bihar. The rate of Omicron in Bihar is of course very high, so the sample size is small currently. So finally, to conclude, diagnostic tests including PCR, antigen detection tests continue to detect infection with Omicron. Genomic sequencing is done for sentinel surveillance of the COVID-19 virus and is more accurate method to track its variants. Fortunately, till date, Omicron has been found to be milder than previous strains, but as per need, NGS technology has the strength to provide insights into virus's ability to infect, its sensitivity to existing vaccines and therapeutics. This is Department of Microbiology, IGIMS. I'm happy to share these pictures. It is well equipped with advanced diagnostic facilities, instruments like automated bacteriology laboratory, contains Bactalert, Vitek2, BD Phoenix, and this is Multitop. BSL3 laboratory contains automated MGIT, liquid DST, Gene Expert, TrueNat, LPA. Recently, we introduced LPA facility, that is line progressé. The molecular laboratory, the automated instruments like Cobas 4800 is there. BioFire, this multiplex PCR system is there. The PCR, many PCR machines are available with us. This is dedicated COVID-19 lab, the automated RNA extractor, the PCR machines. And this is MySeq gene sequencer in the Molecular Genomics Laboratory. Thank you.
Thank you, ma'am, for your very impressive, illuminating and insightful deliberation. So because there is time constraint, without wasting much time, I'd like to invite our next speaker, Dr. Manish Shankar, who is currently head of pulmonary medicine, IGIMS, and he will speak on clinical features and management of newer variants of Omicron. So over to you, Manish.
Thank you, our director, sir, Guha, sir, all the speakers, and all the audience, and a special thank to Walter Kluwer for giving me this opportunity as a speaker for the newer management of newer Omicron variant of COVID-19, which is wreaking havoc. So I will be dealing with mainly AIMS ICMR COVID-19 National Task Force under Ministry of Health and Family Welfare Government of India guidelines regarding the management of COVID-19 patients. And this guideline has been revised on 14th of January this year. So regarding COVID-19, you all know that COVID-19 has been classified according to the severity of the disease. COVID-19 patients usually presents with symptoms of upper respiratory tract infections such as cough, cold, running nose, sore throat, fever, and if these symptoms presents without shortness of breath or any hypoxia, then this is categorized under mild disease. And mild disease are basically managed at home or in COVID care facility. When we call COVID-19 a moderate disease, that any symptom of respiratory tract infections with association with tachypnea or respiratory rate when there is more than 24 per minute, or patient is having breathlessness along with falling saturations. If it falls below 93%, range is 90 to 93% on room air, then this is classified under moderate category. And whenever a patient detects himself saturation falling or respiratory rate increasing, he should become alert and immediately contact his treating physician and get himself admitted in hospital. When we call COVID-19 a severe disease, when respiratory rate increases more than 30 per minute, when there is breathlessness and saturation drops below 90% on room air, these patients are very sick and they should immediately be admitted in either HDU or ICU. One more classification is critical disease, and critical disease is said when a patient is having features of ARDS or he is having septicemia or septic shock and he is needing ventilatory support, then this is classified under critical category. So what are the signs and symptoms of current Omicron variant of COVID-19? First and foremost is fever. Fever has remained mostly mild, maximum up to 102 degree Fahrenheit, but it can go beyond that, remains for 2 to 3 days. Type of discomfort in the throat. Weakness has been found even after recovery from Omicron for few weeks. Headache is found in up to 50% of cases, and some of them it is really excruciating. Body ache, backache and fatigue is common symptom. Congestion or running nose has been seen in a few patients. Cough has remained been productive in Omicron variant in contrary to dry cough which was seen in Delta variant. Night sweats and diarrhea are found to be atypical symptoms and found in few. One relaxing point with Omicron is that pulmonary symptoms are found in very few patients, and very few patients develop shortness of breath and hypoxia. But this does not mean that one should become complacent and take less care of this Omicron, because it can be really lethal. Nausea or vomiting has been found in few, and loss of smell and taste, which has been seen in Delta variant very frequently, is not very common in Omicron variant. So some red flag sign when a patient should become alert: when he is finding himself having dyspneic, respiratory rate rising above more than 24 per minute, or saturation falling less than 93% on room air, then he should become alert and immediately contact his physician. When high-grade fever or severe cough is persisting for more than 5 days, when a patient is getting confusion or he is unable to stay awake, then this is alarming symptom. Blue colored skin means when a patient is getting cyanosis and his PaO2 FiO2 ratio is falling below 300 on room air, then this is warning signals and patient should immediately consult his physician. So how to manage a case of mild disease? Mild disease is basically managed in home, and COVID appropriate behavior should be followed in mild disease. In fact, in every category, physical distancing, mask use and strict hand hygiene is a must, and patient should manage himself with as per symptom. Adequate fluid intake should be taken. Antipyretics for fever like Calpol 650 milligram on SOS basis, and if he is having nagging cough, then cough suppressants he can take. He should always monitor his body temperature and oxygen saturation by pulse oximeter, and whenever he finds himself any trouble in breathing or saturation falling or high grade fever and cough persisting, then he should seek immediate medical attention. A low threshold should always be kept for high risk patient. Who are high risk patient? A patient who is obese, age more than 60 years, or he is having cardiovascular disease such as hypertension, heart failure, coronary artery disease, or cerebrovascular disease, or chronic kidney disease, liver disease, or he is a case of COPD or asthma, or he is a case of active tuberculosis, or he is a HIV case, or he is on immunosuppression, such as he is having autoimmune disorders, then these patients are at high risk of deterioration anytime. So any of the patient who is having comorbidities should always be alert and should seek for if he finds any signal of deterioration, he should seek immediate medical attention. When a patient is having fever or cough persisting for more than 5 days, then he can take inhalational budesonide at a dose of 800 microgram twice daily for 5 days. I have already dealt with high risk features. One more thing is important. If cough persists for more than 2 to 3 weeks, then doctor should rule out the other causes of cough, such as tuberculosis, which is very prevalent in this part of the world, and other conditions, secondary infections, pneumonia, he should always rule out. Now, management of moderate disease. Since moderate disease are hypoxic, they should be treated with oxygen first. So oxygen is a drug, and target saturation should be maintained between 92 to 96%. But if a patient is having history of COPD, then target saturation should be between 88 to 92%. Different interfaces are available for oxygen support, such as nasal pronge, face mask, non-rebreathing mask, HFNC, NIV, etc. So depending upon the requirement of oxygen, he can use appropriate mask, appropriate interface. Awake proning is encouraged because it has been seen that proning leads to recruitment of basal part of the lungs, leading to better oxygenation. So proning is encouraged in different positions sequentially from half an hour to 2 hours. Now few points about anti-inflammatory or immunomodulatory drugs. In recovery trial, it has been found that steroids are very effective in lowering the mortality and hospital stay. So in a patient who are hypoxic, so injection methylprednisolone 0.5 to 1 milligram per kilogram body weight in 2 divided doses or an equivalent dose of dexamethasone should be given in a patient for 5 to 10 days. But it should always be kept care of that steroids should not be used in a patient who is not hypoxic or who is not needing oxygen, because trial has said that this is detrimental. One more thing to be kept in mind, that any prolonged use of steroid or higher than required dose of steroid can lead to secondary infection. And we all have seen in the second wave that lots of patients of invasive mucormycosis came. So it should be taken care of. Since COVID-19 is a prothrombotic disease and it can lead to pulmonary arterial thrombosis and or deep venous thrombosis, so prophylactic unfractionated heparin or low molecular weight heparin should be used, such as enoxaparin, at the dose of 0.5 milligram per kilogram body weight subcutaneous, provided that he has no contraindications or any high risk of bleeding. Patient should be always monitored about his respiratory rate, pulse rate, blood pressures, and any change in oxygen requirement. Serial chest X-ray is done to see whether patient is deteriorating or not. HRCT chest should be done only when there is indicated, not in each and every patient. HRCT thorax should be done only in a patient either who is deteriorating or who is presenting features of COVID-19, but his RT-PCR is negative. So as just to confirm, to see the radiological findings of COVID. Laboratory monitoring should be done, such as inflammatory markers, CRP, D-dimer, blood sugar every 48 to 72 hourly, and complete blood count, RFT, LFT every 1 or 2 days. Now coming on to the severe disease, we provide respiratory support either in the form of NIV or high flow nasal cannula. When work of breathing is low, we can provide NIV, but when patient is not improving on NIV, we can use high flow nasal cannula with FiO2 up to 100% with a flow rate of up to 60 liters per minute. But whenever a patient, if he is not improving on NIV or HFNC, then this patient should be immediately intubated and to be kept on mechanical ventilator. And ventilatory management should be done as per ARDS net protocol. In severe disease, we should use steroid at higher doses between 1 to 2 milligram per kg IV in 2 divided doses methylprednisolone or equivalent dose of dexamethasone, usually for a duration of 5 to 10 days. And we should always look for any complications of steroid. We should maintain euvolemia, that is BP pulse, blood pressure should be maintained. If patient is developing any sepsis and septic shock, then appropriate antibiotics along with sepsis and septic shock should be managed as per surviving sepsis campaign guideline. We should always keep an eye over the patient clinical parameters such as tachypnea, hypoxia, pulse, blood pressure, and change in oxygen requirement. Similarly, chest X-ray should be done and HRCT thorax should be done on as per requirement basis, and lab monitoring should be done routinely. So after the classification of COVID-19, to manage, what are the options we have? We have antivirals in the form of remdesivir. Remdesivir has been used a lot in second wave of COVID-19. So you all know about remdesivir. We have other options available such as Paxlovid and molnupiravir. Now coming about monoclonal antibodies, one antibody cocktail which has been used widely in phase 2 is casirivimab and indevimab. And the second monoclonal antibody is sotrovimab. Janus kinase inhibitor, we have baricitinib. Interleukin 6 receptor blocker, we have tocilizumab and sarilumab. Then steroids and anticoagulants. So I will discuss each and every drug separately. So regarding remdesivir, what are its indications and when it should be used? It has got emergency use authorization and it should be used only in patients who are hypoxic, who are requiring supplemental oxygen. So it should not be used in mild disease. Recommendation as per ICMR. It should be used in moderate to severe disease, but only in patients who are requiring oxygen, but not who are on invasive mechanical ventilations or on ECMO support. This drug is most effective within 10 days of the onset of symptom. This drug should be given in a hospitalized patients for 5 days, and whenever it is given, we should monitor the renal function test and liver function test, and should not be given if his GFR is falling below 30 milliliter per minute per meter square, or liver enzymes are above 5 times of the upper limit of the normal. And the recommended dose is 200 milligram IV on day 1, followed by 100 milligram IV OD for next 4 days. Recently, PINT trial has concluded, and results has been published in the New England Journal of Medicine just in last month, January 27. And it has given very encouraging results about remdesivir. And the study was early remdesivir to prevent progression to severe COVID-19 in outpatients. And the conclusion was that among non-hospitalized patients who were at high risk for COVID-19 progression, a 3-day course of remdesivir had an acceptable safety profile and resulted in an 87% lower risk of hospitalization or death than placebo. So it can be used in a patient who are at high risk of COVID-19 progression. That is a patient who having comorbidities for 3 days. Now coming on the next drug is Paxlovid. What is Paxlovid? It is the combination of 2 antiviral drugs, that is nirmatrelvir 150 milligram 2 tablets and ritonavir 100 milligram 1 tablet, and this should be taken for 5 days, and it has been seen that it has got 90% efficacy in preventing hospitalization and deaths in high risk patients. So it can be used in mild to moderate disease. And it has been seen that drug has retained its effectiveness against Omicron variant. But this drug is not available in India yet. Other drug is molnupiravir. It has been talked about a lot, and one move out trial on which basis this drug has been rolled out says that COVID-19 related mortality, hospitalization or death may be lower in patients receiving molnupiravir than placebo. But its current position is that this trial was done in patients who was not having any recent or past SARS-CoV-2 infection. And also this test was not done in a patient who was vaccinated. And this drug has also some safety concerns, that it cannot be used in a patient who is less than 18 years of age. It is also cannot be used in who are pregnant, or if a male person is using, he should use appropriate contraception for up to 3 months after the use of molnupiravir. This drug can cause mutagenesis. So because these concern it has found limited utility in the current management of Omicron. So this drug has not been included in the clinical management protocol by National Task Force, citing safety concerns and finding not of much benefit. But I think that when a patient under mild to moderate category, if he is not having, he cannot be used remdesivir, or he is not, remdesivir is not available, then molnupiravir is an option which is available in India right now. Now talking about anti-SARS-CoV-2 monoclonal antibodies. One drug, that is sotromivimab, and recent trial and has been published by WHO that it can be used for patients with non-severe COVID-19, that is mild to moderate risk of COVID-19 patients who are at highest risk of hospitalization. And it has found that it causes a substantial reduction in the relative risk of hospitalization, and it has retained its activity against Omicron variant also. But this drug is also not available in India right now. So there is no point talking about much about this drug sotrovimab, but whenever it becomes available, what led to evidence to this decision is in patients with non-severe illness, sotrovimab reduces hospitalization. Although there is no data on time to clinical improvement, and it cannot be used in severe or critical disease because it has little or no impact on mortality and on mechanical ventilation. What is current position of antibody cocktail, that is casirivimab and imdevimab? The evidence right now indicates that this antibody combination lacks neutralization activity against the Omicron variant. This drug, this antibody cocktail has been used in lot in Delta variant, but currently its use in Omicron variant is limited, whereas sotrovimab retains its activity against Omicron in pseudoviral assay. This antibody cocktail, casirivimab, imdevimab, is available in India. And point is, when a patient is having high risk of hospitalization and we do not know whether this patient is having Omicron or this patient is having Delta, because we cannot subject each and every patient for next generation sequencing. So in that case, we have the option of casirivimab and imdevimab, and don't know whether a patient can be having Delta variant. So this drug has got some role in the current wave. Now some points around JAK inhibitors. Baricitinib, a JAK inhibitor, has got strong recommendation in severe or critical COVID-19 patients. And this has been found as an alternative to interleukin-6 receptor blockers such as tocilizumab. And it should be used in combination with corticosteroids in patients with severe or critical COVID-19. Although it has been found that other JAK inhibitors such as ruxolitinib and tofacitinib has not found any favor in patients with severe or critical COVID-19. So, baricitinib should be used along with corticosteroids in patients with severe or critical COVID-19. And the evidence to this decision was that in patients with severe or critical illness, baricitinib reduces mortality and duration of mechanical ventilation, and it also reduces hospital length of stay. So we have two options. Either we can use interleukin-6 receptor blockers or baricitinib, but both drugs should not be given together. We should use either IL-6 blocker or baricitinib along with steroids depending on availability and contextual factors. The recommended dose is 4 mg daily for 14 days total treatment or until hospital discharge, whichever is first. And dose is reduced as per GFR of the patient. Now some points about tocilizumab. Tocilizumab should be considered within 24 to 48 hours of the onset of severe disease or ICU admission in a patient who is progressing COVID-19, who is requiring oxygen supplementation or is not responding to steroids and is on mechanical ventilation. And always secondary infections, tuberculosis, fungal infections should be ruled out because it causes severe immunosuppression that can lead to secondary infection. So previous infection or present infection should always be ruled out. And always long-term follow-up should be done for any secondary infection such as reactivation of tuberculosis or flaring of herpes zoster and it should be used when there is significant elevation of inflammatory markers, that is CRP and or interleukin 6. And its recommended dose is 4 to 6 milligram per kilogram body weight in 100 ml NS over 1 hour. What led to this recommendation? It has got a strong recommendation in patients with severe and critical COVID-19, and it should be given along with steroids. And it has been seen that it reduces mortality and need for mechanical ventilation based on high certainty evidence. Some low certainty evidence also suggests that it also reduces duration of mechanical ventilation and hospitalization. Now, some points about discharge policy for COVID-19. A patient who is having mild case of COVID-19 should undergo regular health monitoring, and 7 days have passed of testing positive, and he has having no fever for last 3 days, then he can be discharged. There is no need for testing prior to discharge. And moderate COVID cases who are admitted in dedicated COVID health center, whose signs and symptoms have resolved, and he maintains saturation above 93% for 3 successive days, can be discharged with an advice of treating medical officer. But a patient whose signs and symptoms have not resolved and demand of oxygen therapy continues, such patient should be discharged only after the advice of treating medical officer, when his clinical symptoms resolve, or he is able to maintain his saturation for last 3 successive days and his comorbidities are stable. And severe cases and patients who are immunocompromised, such patients are discharged only on clinical recovery at the discretion of the treating medical officer. He should be under continuous supervision of his treating physician, and if he develops any symptoms of fever, cough, or breathing difficulty, he should immediately contact his treating physician. So, to conclude, Omicron variant has been found till date to be mild, but we should not become complacent, and there should be always high risk of suspicion should be there that any patient who is having comorbidity, or if he find himself deteriorating, should immediately contact his physician or get himself admitted in hospital. Thank you all.
Thank you, Dr. Manish, for your wonderful deliberation. You have really elaborated and elucidated the subjective symptoms, subjective signs, and you have explicated the top tenets of management and the details of pharmacotherapy. So, in fact, you and your team really has shown the steadfast commitment for delivering the high quality, highest quality clinical care during the trying time of COVID-19, and IGIMS is really proud of you and your entire team. Thank you very much. Now, without wasting much time, because we are running short of time, I invite our next speaker, who is also has done a marvelous job in the field of COVID vaccination, Professor Dr. Sanjay Kumar, our HOD Community Medicine and Nodal Officer COVID-19 vaccination. In fact, it has started in IGIMS and it is continuing, and different phases, first wave, second wave, and first dose, booster dose, and all. He will explain everything in details during his lecture. But he, again, with his team, they have done a really laudable and commendable job so far, and we are really thankful to them, and we are really proud of them. So over to you, Professor Sanjay, sir.
Thank you, sir. Good afternoon to Director, sir, all other speakers, other person from Walter Kluwer, all these participants. My file is being extracted right now. I'm trying. Basically, for the Omicron, the basic thing that has already been discussed by Dr. Namrata, and management has already been discussed by Dr. Manish. So the other part that we have left is to protect ourselves and others from this devastated this disease, or we can say this wave, different wave we have came across, and we tried ourselves, we tried others to get it protected themselves as much as possible. So this matter was taken up by WHO, the agency that has declared that is pandemic, it's not a local problem, and in that way the whole world tried to fight with the problem with the capacity. Right now globally we have almost 391 million cases that is confirmed, and more than 5 million cases that has been that died due to this COVID-19. For the India, we have 42 million cases that has been confirmed, and almost more than 5 lakhs of people, they have lost their life in this pandemic. All countries, including India, they try to measure, try to contain the disease with the diagnosis, with the treatment, and all this management treatment that has been built was on scientific basis and with the WHO guidelines. The commitment that was for the sake of making vaccines for COVID-19, it has been started with the time we have got that this is a problem of whole world, and that was depending on the strengthening research development capacity to encourage and enabling manufacturing, and that vaccinating each and every individual, particularly in India. So government of India took all these measures, all these basic basis, so that we can make vaccines and for the sake of containment of the disease. The basic way we have to protect ourselves as well as our surroundings, the basic need is to wear a mask. This is a must, and most of us we are following. We have to make our environment safer. We have to keep hygiene in a good condition, and if someone gets problem, someone is feeling well, see someone is not feeling well, and what to do for those person. In protecting ourselves, we need to get vaccinated. This is one of the mainstay of containment of the disease. Keep physical distancing, wear mask properly, clean hands, as already this is being spread, this is being circulated, we have come across a lot of time, but we need to emphasize, we need to remember, we need to trigger time and again, so that we just in the back of the mind we have that habit to do all those things. Wearing a mask, actually this is one of the important thing, but many a times we are just looking in the market, we are going to the market, we are going to the different places. We see this is a case where we just show that we have our marks, whether it is in the mouth, whether it is in the neck, whether it is in the nose. So the proper use of mask is a must. We need not to show that we have taken mask. We need not to take that, okay, police will take call of not wearing mask. So that is not the case. We have to protect ourselves. So a proper use of mask is a must. Then environment. The risk of getting the COVID-19 disease that is higher in crowded place, that we all know, and where the ventilation is not proper. So the most of all the outbreaks that has been we have seen like restaurant, fitness classes, nightclubs, and so those places where we have ill ventilated area or crowded places. So we have to avoid 3 C's like closed spaces, crowded place, and where it involves close contact. So we have to take care of these 3 C, and then we can take ourselves in a safer side. Outside a place, open place is a rather is a safer than this closed space. And in due course, many places we have made like this, that we have made circles, we have made boxes, particularly where the shops are there or where the malls are there or in the temples and so other places, so that a proper distancing can be done. And another picture showing the fan, that is for the sake of ventilation. If we have places where we need to work, so we can just ventilate proper that place and reduce the risk of getting COVID-19. Hygiene is important. We follow good respiratory hygiene and we can protect. Regular and thoroughly clean our hands, either with the alcohol-based sanitizer or with any soap, normal soap. With cover mouth and nose. And if we have sneeze, we can just use our elbow to take the sneeze, and so that we can spread our sneeze to the common places. The preventive measures that is very common, that is visuals, that we have to keep distance, we have to wear mask, we have to open the windows, we do not we avoid this crowded place, wash hands, sneezing, etiquettes, and vaccination. These are few preventive measures that is a must for containment of COVID-19. If someone gets or someone feels unwell, then very common, as Dr. Manish has told, very common feature is fever, cough, like this. So the proper knowledge of the symptoms of COVID-19 is important. They should stay at home and get tested. If the test is positive, then again he has to consult doctors. And if positive, then isolate yourself. This is very common because this time the disease was very mild. So many more cases they got themselves get rid of those diseases in home isolation only. Another mainstay that was the vaccine that has been developed by many countries, and it is given to all the people, even the lower age groups, they have also got different vaccines that is available for them. So for that, say, Government of India initiated early proactive measures. In April 2020, a task force was made for the focused research on coronavirus, and another national expert group on vaccine administration for COVID-19, NECVAC, has been constituted, and they have been given task to develop and how to administer. For that, another empowered group was made to just transport simple, escapable, and how the vaccine can be given to the individuals in a proper way without any problem, because the country is big, and handling all the states, all the individual adults in one time was a big this Indian this government, they took call properly and they handled it very well. The vaccine doses were provided to all the state government free of cost to all the adults, that those who were eligible, and for the sake a platform was made, that was COVID platform, for the sake of appointment, for the sake of getting vaccination. And this COVID portal that was made very robustly and is still running very nicely. The Intergovernmental Technical Advisory Group on Immunization, as well as Standing Technical Scientific Committee, they have decided further refine scientifically and prioritize and coverage the individuals for the COVID-19 vaccines. And this vaccine was introduced in the age group of 15 to 19 that was started recently in 3rd of January this year. And for this age group, Government of India has given Covaxin only, this vaccine only that has been given the positive note to give the vaccines to the 15 to 18 age groups. Other groups that were already given, like healthcare worker, frontline worker and other, they were also given precaution dose from the 10th of this year, after completion of 9 months of second dose or 39 weeks of second dose, and that is going on properly. Right now 162 crores actually in doses that has been given, and 62% of the total population, adult population, that has been covered both with the both doses of COVID-19. For the vaccine, it is basically depend on 4, 5, 6, rather we should say 5 or 6 type of vaccines we are making. One is viral vector, that is AstraZeneca is making, and RNA vaccine is making. Whole virion that we have inactivated that is Covaxin, and protein subunit that is made by Novavax. So these 4 that has been given in India. We have a full dedicated team of COVID-19 and many dignitaries from the state that has been given vaccination is one of the dignitaries that is being given these vaccines. The COVID portal that is made, we have all facility on the COVID portal. Now the healthcare worker, frontline worker, and 60 plus citizen who have eligibility, who have some comorbidity, they are given precaution dose. The eligibility already, the second dose already completed, and after 9 months of second dose or 39 weeks of second dose, they can register online, they can register offline, rather they can come to the site or the vaccination site and they can get registered themselves. For 15 to 18 years, the same, that Covaxin that is given, they can also register on the COVID portal and they can come to the site and they can register offline there only. For any disease or any viral problem, this transmissibility, virulence, and its ability to evade immune response, that is the mainstay of getting a disease or a disease that comes in our body and they create problem. So the WHO, they have given some suggestions that community also should know the problem that this virus they are doing, like mutation. It's a normal for any virus. Mutation is a normal. So it is our role to spread this information to the population, to the people, so that they can come across and they can know that this is a normal thing and that is happening for all viruses. So this type of information, that is a must to come into the picture, to come into the community or in population. For WHO has a global approach to monitor and assess SARS-CoV-2 variant, including Omicron, and that was done on technical advisory group for virus evaluation that was made, and that was evidence assessment was done with research development blueprint, and they have tag for COVID-19 vaccine composition. And on that basis, a policy is being made that is done through strategic advisory group of experts, and they are advices for vaccine, for other thing that is needed for containment of any disease. Now revised advisory for managing healthcare worker. This is actually the healthcare worker and frontline worker, they are always at risk. They were on risk in the first wave, second wave, third wave, because even after lockdown, the healthcare worker and the frontline worker, they were doing their duties at their place, and they were more exposed than others. So preventive measures to be observed at institute level. Testing isolation measure for healthcare professional functionaries is a must. For health associated infections, all health facilities shall have active it's a hospital infection control committee. That is a must for any hospital. And the hospital infection control committee in the hospital facility, they are responsible for implementing this infection prevention and control. A nodal person, a nodal officer is designated for the sake of this health associated infections. The healthcare worker in different settings of hospital, they use PPE kit that is appropriate for their profile, because we have different type of risk at a different place in hospitals. All healthcare workers have to undergone training on infection prevention control. Provision has been made for regular screening of all staff. All healthcare workers were vaccinated for 2 doses of COVID-19 vaccine, and the provision has been made for prompt reporting of breach of PPE by hospital staff if it occurs anytime during the period of their work. So action, all preventive measures like frequent washing hand, use of alcohol-based sanitizers, that is to be followed. PPE kit all the time while on the duty is a must. A buddy system to be followed to ensure that there is no breach in the infection prevention practices, and if any breach and exposure is immediately reported to the nodal officer. Healthcare worker, after leaving the patient care units at the doctor's duty room or outside, must follow the physical distancing and masking to prevent transmission to others. And pregnant and lactating mother, immunocompromised healthcare worker shall inform their medical condition to the hospital authorities. There has been a SOP made by Government of India to follow the case of healthcare worker reports if there is a breach. So there is a system, if there is problem, if there is breach in PPE kit or PPE during their work, so the system has to follow and SOP has to be followed. This is revised guideline for home isolation that Dr. Manish has more or less covered, and it should be followed during home isolation. Appropriate behavior for COVID-19 is 3 Ws and 2 Vs. Watch your distance, wash your hands, and wear a mask. And 2 V is like ventilation and vaccination. These are must for the containment of this problem. For international travelers is revised. It was revised in this year only that all the travelers they should, particularly this is for in the case of India, they should give self-declaration on Air Suvidha portal. They should get vaccinated of COVID-19 and they should have RT-PCR report. So these things they must have during international travel. Before boarding, passengers originating or transmitting from at-risk countries shall be informed by the airlines that they will undergo post-arrival testing, quarantine if tested negative, stringent isolation protocols if tested positive. So these things has to be followed after coming to India from a country that is risk countries. we should follow do's and don'ts. Airline also have to allow boarding to only passengers who have filled information on the self-declaration form on AirSuvidha portal. All the at the time of boarding the flight, only asymptomatic travelers had to be allowed to travel, and all passengers shall be advised to download Arogya Setu app on their mobile. That is developed by Government of India, and it's very fine app. During travel, all the etiquettes has to be followed and all the protocols has to be followed during travel. On arrival, deboarding should be on physical distancing, and here also all the protocol that is made for COVID-19 to be followed. For vaccination, we have a guideline where to vaccinate, whom to vaccinate, and how the area should be. So there is outline that Government of India has made, that we have a separate entry and exit. We have this waiting area, ventilated waiting area. We should have all things in a vaccination room. We should have all those different color of dustbins. This is one of the model that has been shown, that we should have like this in a vaccination room. And this is the observation room. After vaccination, we have to wait for half an hour. So this is also one of the ventilated room that is a must for observation of those individuals who have taken COVID-19 vaccine. Thank you very much.
Thank you, Professor Sanjay sir, for very lucidly explaining all the top tenets of preventive measures. This is very useful for the common mass, and everybody must know and must follow. This is because we know prevention is better than cure. And now, because we are running really short of time, and I have got some other assignments also, I think Ms. Remia, can I speak a little bit? And now?
Yes, sir. Yes, sure.
Okay, so actually, I just want to summarize. Firstly, again, I want to thank our Director, Vice Chancellor, Professor Nar Biswas, for accepting our invitation and becoming the chief guest. With his blessings, we moved ahead, and the Walter Kluwer's team done wonderful job. And all the speakers, I am really thankful to Professor Namrata Kumari, Professor Sanjay Kumar sir, and Dr. Manish Kumar sir. They are really doing wonderful job in their real life in our hospital, and their presentations were absolutely marvelous, very, very illuminating, impressive, informative, yet intelligible. And they have elaborated, elucidated, and explicated all the top tenets of COVID-19 and Omicron with regard to its testing, and with regard to its next generation sequencing, with regard to its say sign symptom management, and last but not the least is the preventive measures. Actually, regarding the scope for research during this COVID pandemic, for the PG students, for scientists, and for researchers, if you have seen already, you have heard all these deliberations, and it is very clear that the scope of research is plenty, because from the virus only you can start the research. The virus itself is a matter of research in different variants, and you can now we can identify the variants through the next generation sequencing, and we can have plenty of research on their spike proteins, their structures, their mutations, and everything is a research material. And then about the management modalities and clinical trials, about the drugs, clinical trials of the drugs and the vaccines, everything, and the other preventive measures. And apart from that, during this trying time, because the medical education as not even medical education, all education system has converted from offline to online version. So we can compare the offline and online teaching learning method, and that can also be a part of that can also be a scope for research. Actually, a lot of articles have already been published about this online and classroom teaching and the effectiveness and how effective it is, and then about the virus, about its variants, about its mutations, about the structure, about the nature, about the next generation sequencing itself. So many instruments we are having, we are constantly doing in our multidisciplinary research unit, and management and different clinical trials about the drugs. That itself, individual drugs, so many clinical trials can be done, and the cocktail therapy already told, so its efficacy, and then the preventive measures and vaccines. So vaccines, again, the clinical trials and all the levels of trials. So there's plenty of scope for research. It is not that during this 2 years time, COVID-19, though COVID-19 has taken away many lives and a lot of adversities and atrocities took place, but still it has opened new channels of thoughts, and it has offered a lot of scope for research for the PG students, for the scientists, for the researchers. So with these few words, I like to express my indebtedness and thankfulness to the World Records team for their support, and our director sir for giving the consent and being the chief base, and all the speakers for their wonderful deliberation, and all the audience who really made this webinar successful. So this was from my end, and I can now request next speaker to carry forward, and I will be in touch. Thank you very much.
Thank you, Dr. Ranjit Guha. Thank you so much. So now I would request Rajiv, Training and Implementation Manager, Walters Clover, to talk on our product, Gideon, your go-to-go resources on infectious diseases. Rajiv, over to you now.
Everyone, this is Rajiv, and I'm a training and implementation consultant at Walters Clover. And so far the session is absolutely brilliant. It's going amazing, as our speakers has covered almost every aspect of COVID-19, Omicron variant, which includes next generation sequencing management, protection, and scope for students and researchers in this prevailing situation of COVID pandemic. The other day, I was going through an article, and which is published in Nature Review Microbiology, which is about infectious disease in an era of global change. And it says that in the 21st century, we have witnessed a wave of severe infectious disease outbreaks, and not least the COVID-19 pandemic, which has had a devastating impact on lives and livelihoods around the globe. But in 2003, we have severe acute respiratory syndrome coronavirus outbreak. Similarly, in 2009, we have swine flu pandemic. And in 2012, in the Middle East, respiratory syndrome coronavirus outbreak was there. Similarly, in 2013 and 16, between 2013 and 16, there was Ebola virus disease epidemic. And in 2015 has been recognized as Zika virus disease epidemic. And all of them resulted in substantial morbidity and mortality while spreading across border to infect people in multiple countries, actually. And at the same time, these recent global changes have increased the risk of infectious disease outbreaks. When we say recent changes like climatic change, technological changes, demographic changes, and with this, I strongly believe we should have adequate resources which will be able to support us in accurate diagnosis, keep us updated on the latest global outbreak as they evolve and spread, something which dig deep into epidemiological aspects and uncover new infectious diseases and pathogens in nearly every country around the globe. So let's discuss one of the offerings from Ovid, Walter Kluwer's, which supports on all of these aspects. So I'm talking about Gideon. Gideon is Global Infectious Disease and Epidemiology Online Network, which is a go-to resource for any of your requirement on infectious disease or epidemiology content. We'll discuss more on it. Just a second. Okay. So Gideon is basically the global infectious disease knowledge management tool. And the web app is very easy to use. It is very interactive and comprehensive and helps you overcome information overload while saving time and a lot of information which is available on the open space. Gideon is used for diagnosis support and informatics in the field of tropical and infectious disease, epidemiology, microbiology, and antimicrobial chemotherapy. Because of its focus, Gideon does not have to compromise in functionality, and it can cover all important aspects of infectious disease with dedicated functionality in the two main content modules. Broadly, infectious disease, we call this diagnosis as well, and microbiology or lab. So we will review these once we go to product demonstrations. But before that, it's important to understand what Gideon covers. What does it consist of? So here is some of the details of the content in Gideon. As I mentioned, Gideon is global data source, includes essentially the entire world's literature and adhere to the standards of evidence-based medicine. It contains information about infectious disease that caused by organisms such as bacteria, mycobacteria, parasites, and viruses. And especially the microbiology section covers organisms where there is an easy clinical testing, not generally viruses, which requires special cultures or DNA testing. So for example, avian influenza is listed as disease, but not causative virus. Similarly, the parasites are also not listed in microbiology section because testing for parasites is complex. However, the causative parasites are listed in diseases, but not in microbiology. Gideon is composed and updated from the resources which are mentioned over the website like PubMed, WHO guidelines, National Health Ministry reports. And these content is monitored daily and there are daily added alerts, but our database is updated approximately 2 times every week. Now the important question is, who is it for? Who generally uses Gideon? So Gideon is used in hospitals, universities, private practice, public health departments, and military installations. And in these setups, who use Gideon? It is used by physicians, microbiologists, epidemiologists, and other healthcare experts. So there are multiple ways to access Gideon. One is via the Ovid access. If you have an Ovid access, you can go to the link outs options and you can reach out to the final product and database, or else we can provide you direct link, which you can go to the web browser and browse the database Gideon. So when you go to home page of the Gideon platform, you will see these 4 focus subject categories, which consist of explore, lab, diagnose, and quantify. All the sections links to each other and are searchable. So it is easy to move within the information. So the flow from the disease to the cause of the disease or other information is quite seamless. Within Explore, you'll find various list of icons within Explore, which indicates the scope of the content in Gideon and guide your selection. So because this access covers everything in the database, it could be for anyone. Explore, when I say Explore, let me highlight here. So within this Explore, these icons are present. And Explore is primarily about browsing across the content and selecting items of your interest. To search across all the content or parts of it in a single step, you may also use search from the top right. So there are multiple functionalities available, like you can search only in disease, or only in drugs or vaccines, or if you want to search across all the available content, then you can use this search from the top. And as I mentioned, when you choose explore, the icons changes to include browsing and searching selections for the disease, drug, vaccines, microbes, and various countries that are within the Gideon content. So without wasting much time, let's go directly to the demonstration part, and we will see how it appears. So I'm just stopping my screen share just for a moment, and then I will come back. I hope my screen is visible where I am on the Ovid platform. And from here, once I logged into the platform, as I said that the access to Gideon is through the link out. So you can come onto this page. There are links given here, and you can click on Gideon, open a new page, a web app basically for Gideon, where as we have mentioned in the slides, you will find these 4 basic major icons, which consist of explore, lab, diagnose, and quantify. If you want to understand further like what explore contains, you can use this question mark option where it covers all the details that what is being covered in explore. Similarly for labs and diagnose and quantify. There are multiple ways to find out the information. As I mentioned, you can start with the search and browse the content from all the available resources and available from explore, lab, and diagnosis, quantify, or you can go directly to each icon as per your requirement. So let's begin with explore section, where we have multiple things available like disease, drugs, vaccines, microbes, and countries. This feature, if you feel that you quite often come to the Gideon and you want to search, go only to the explore part, and you are not much interested in lab, diagnosis, quantify, then you can make this page as your default page. Similarly, this default option is also available for lab, diagnose, and quantify pages. When we will go to these 3 tabs, I will show you subsequently. So within explore, let's start very quickly with the disease. So like if you want to see any disease in terms of their clinical findings, in terms of causative organism, in terms of how to manage that particular condition, you can go to explore and disease options. It gives you 2 options to find out the information. One is either if you have a disease in your mind, you can simply type in here. Like for example, if I want to see something on tuberculosis, so I can go like this, or in that sense, as we are talking about COVID-19, I can also type COVID and it will give me options to browse and search amongst it. Another way to find out the information is by fingerprint option. So if you click on fingerprint, it gives you a lot of options. Like if you know about agent, you have information on vector, vehicle, reservoir, or a country specific data, you can choose an option here. For example, like if I choose here any agent, maybe bacteria, if I want to see bacteria, so I can use bacteria. Vector could be anything. So the moment I put bacteria, it will suggest me all the diseases which are associated with the bacteria. And here I can choose any vector if I have mind in like bug, flea, fly, like mosquito, or can just go with any also. Within this, there is a vehicle. So if I want to say it is transmitted through droplets, or it is more about humans, so I can choose human as a reservoir. Country, you can obviously find out the specific country, or if you want to see a global, then you can leave it behind blank. So within India, about the bacterium, and with this vehicle, droplet, dust, aerosol, and human as a reservoir, these are the 11 diseases which come across. Before we move on to clinical side and what are being covered in specific disease, you can see here there are some plus signs you are able to see. What does it indicate? Indicates means like we have one functionality here. You can see compare is there. So I will come back to that compare part. But if you want to compare any disease, you can just simply add it by using this button. So I have added tuberculosis already here, which I want to compare with some other disease. that I will show you how to choose that. But wherever on any page you find any information which you feel that you need to compare with something else, you can simply use this plus sign. This plus sign would be available in Explore, Lab, Diagnose, everywhere where you need a comparison between these disease or causative organisms or maybe other conditions. So let's open tuberculosis here so that I can show you what does it covers. Within the tuberculosis, you will find the summary. In summary, you will find what are the various agent of what is the agent for this particular disease, whether any reservoir is mentioned, vector, all that information which we have chosen will be part of it. And then you have the related diseases and what are the various synonyms for tuberculosis. And then you have an image section which talks about histopathology of tuberculosis. You can see various pictures here, and this is like photograph of a 4-pronged instrument used to administer the tuberculin test. Similarly, all the images are there which you can use. Then you have clinical finding, the definition from the WHO, various kind of tuberculosis, clinical presentation, differential diagnosis, and of course you can download this entire information into PDF, or you can share it and you can see the references involved in producing this entire the clinical information on tuberculosis. But not only this, so for example, if you want to see what is the situation of tuberculosis in any other country, what you can do, you can see the worldwide nodes and outbreaks, whether if any time tuberculosis outbreak happened and where it happened, you can actually use this outbreak maps. So like if you want to see any country specific nodes, like for example, if you want to see something in Cambodia, you can simply click here and you can see the status of tuberculosis in Cambodia, like with the vaccine schedule is there, where there are a lot of graphical representation is available. So like if you are looking for any data globally or any specific country data on particular condition, then certainly Gideon is your go-to resource. And this is information you can see in a data table, or you can see it in a graph from here, like and then we have also recently included this prevalence surveys, so you can see various surveys of which are also part of it. Not only this, but if I go back here, if you want to see outbreak maps, so it will show you the outbreak happened in tuberculosis, and it is covering a data from 1902 to 2021. So you can see here, like if you click on any of the red balls, sign here with numbers, how many times the outbreak happens, how many cases are involved, which is the location, that you can see more in detail by clicking on the particular numbers. If I talk about India here, and if you want to see what is the legends of these colors, how it is being distributed, you can actually go to not this one, sorry, this you can see as per the list, but here is the legend, like it is covering annual disease rates per 1 lakh population, and these are classification which says that darkest color is more than 150 annual disease rates basically. So here, like if I go to India, so earlier what I have showed you about tuberculosis is a clinical condition. Now it's a perspective or a situation of tuberculosis in India, so which consists of country note. So if there is any country note, you can read this country note here, and then it shows about the vaccination status and how many India tuberculosis, WHO percentage, BCG coverage among 1-year-old population, and you can find a region-wise information also, and when was the first case identified, when was the last case identified, all that information you will find in this, and what are the various healthcare workers, differentiation or the comparison between tuberculosis and HIV infection data, multiple drug resistant tuberculosis, XDR, TDR, all this information you can get from here. So this is about disease within tuberculosis. within the explore and the disease. And then you have worldwide note also. Like right now, what we have seen is clinical side, clinical condition, tuberculosis. We have seen the outbreaks. But if you want to see worldwide, how is the situation of tuberculosis, just go to worldwide and you will have tuberculosis worldwide distribution here. You can have enormous data is available, multiple graphs are available, which gives you a lot of information. So a lot of comparison is possible. Okay, without taking much time in this, let's move on and let me go back. So we have seen there are two ways, one by simply putting the disease name or other by fingerprint, searching by fingerprint. This is about disease. And now in the explore, then we have drugs. So it just not give you the information on disease, but of course in the drug also. So if you have any trade name or a chemical name in your mind, you can simply put in here, or you can search by toxicity, class of drug or spectrum, or any contraindication or interaction of the drug. So like, for example, if I want to see something on rifampin, like this, so it will suggest me all the combination of rifampicin with other drugs here. Also, if I am not sure, I can simply put AKT also if I have any brand name in my mind. Like that, you can search for the drug. Similarly, not only this, in fact, in toxicity, you can select here like any drug which causes nausea and vomiting. You can see the list of all the drugs actually here which causes nausea and vomiting. So here are the drugs you can easily see. And from here also you can actually add to compare to see the various things between two drugs. Okay, it just don't consist of nausea and vomiting, but others also, like you can have multiple. Okay, so like if you want to see something which cause abdominal pain, then again you can use abdominal pain, and there's a list of drugs. So by that way also you can search, and then you have a drug and class of spectrum. So here you can choose like rifamycin. So rifamycins are basically a class of drug which consists of rifampin. So if you choose rifamycin, these are major 4 drugs. So by class of drug you can search here. Then you can have a spectrum also. Suggest like if you want to see drugs which are effective on Mycobacterium tuberculosis, then these are all the drugs which are effective on Mycobacterium tuberculosis. So you can search by spectrum as well. And when you go to any specific drug like this, then it will give you more information on mechanism of action, what is the dosage, and what is the CSF penetration level, and what are the various doses amongst the patient who is having a renal dysfunction or children, and what are the toxicity happening with this rifamycin or any kind of interaction with other drugs. So you can see here all those drugs which has a contraindication or have an interaction with rifampicin. So you can see all these details here, and also it captures all the trade names and various spectrum. Now in this, these are the icons or symbols which talks about this rifamycin is used in which conditions, and whether it is a drug of choice or to be used in combination, or it requires any excision or surgery often required in this situation. So you can see, so like in this, these are like drug of choice, and various other parameters are given. So this is about drug information. And then with the drugs, we have similarly vaccines where you can find not just vaccines, but immunoglobulins also. So here again, you can search by trade names. Like if I want to see something on Covaxin, so Covaxin is available. I can check by a Covaxin, and like again, we have a toxicity and contraindications options available. So if I want to see a Covaxin, I just simply click on it. It talks about mechanism of action, what are the typical doses, warning, toxic signs, and trade names of the drugs, and of course for the vaccines as well. In the microbes, we have bacteria, mycobacteria, and yeast and algae. So you can choose any one of them, or you can choose all. So if, for example, in mycobacteria, if I use, I'm trying to see the details on Mycobacterium tuberculosis. I can see here the nodes, ecology, drug susceptibility of this particular causative organism. We can have various slides, images available for this particular bacteria, which you can see here. And then we have a phenotypes available for this particular causative organism. So you can see here all the phenotypes information for this particular microbacteria. But here you can go back, and actually if you are looking for something else, yeast and algae or bacteria, that also you can search within this microbes option. Let's move quickly to countries. In countries, actually you can compare the overall types of diseases prevalent in any countries, or maybe if you have any patient who is going to any specific country, then you can actually see what is the health of that country, and what is the guidelines for visitors or travelers there. So for example, I'm using Cambodia here, but you can take any country. So it talks about what are the various guidelines. Like you can see here, yellow fever guidelines for is there for Cambodia. Then there is a about 107 diseases which are relevant to Cambodia, and then it talks about vaccination coverage graph of various vaccines and various schedule. Not only this, like here you can see BCG, but like this DTP, HIB, HEPB, it's quite complex. Like if somebody doesn't know about these acronyms, they can simply click on it and they can read T for diphtheria, tetanus, pertussis, Haemophilus influenza, type B, and hepatitis B. Such kind of information can be easily seen from here. So it's a wonderful tool to get all the information at one place. So let's go to the lab very quickly. I know we are short of time, and I want to show the maximum as a minimum time possible. So let's see. In the again here in a pathogen, here we can go to any of the situations here. So like again, as I was discussing and showing more you on Mycobacterium tuberculosis, like when you go to this lab, if you choose to either bacteria or Mycobacteria or yeast, you will find these two things which is common in every all these three, which is the probability engine and another one is decision tree. So it's quite easy. Means probability engine is our classic engine, which actually covers where you can identify the characteristic of a mycobacteria. You can add as per your findings, and then it will suggest what is the causative organism or what is the probable disease. Similarly, in decision tree, it is more interactive. So let's start with a newer one, decision tree here, and then we will move to the probability one probably. So before, okay, so here we can choose multiple options. It gives you kind of flowcharts whether you have find the microorganism having a slow growth or a rapid growth. So we can simply click on rapid growth. If we find rapid growth, then it has a photochromosome or not. Then we can go into this, whether it is a catalyst positive or a negative. I can choose like this. And what is the whether it resists 68 degrees centigrade or it does not resist. So I can say if it is resisting, then I have a further option whether nitrate reduction is there or not. So if I choose no, Then it gives me option whether microorganism is growing at a 25 degree centigrade. So if I choose again no, then it will suggest me certain possible microorganism depending on the preferences which I have chosen. So here you can see pathogen, these three pathogen has appeared, and if I go to show full table, here you can see the 90% probability on the basis of the preference which I have given is Mycobacterium leprae, and discuss this very important feature, which is why not. Okay, so like if you are selecting giving some preference or criteria and it is not suggesting the mycobacterium or algae or bacteria which you thought should be part of this list, you can go to why not section actually. And then like in the beginning I said that Mycobacterium tuberculosis we are thinking it should come here, but it hasn't appeared in the list. So why, if you want to know the reason why it has not appeared, simply just come here and you can either search for that. So I'm just searching for this particular bacteria, mycobacteria, and see why it has not come. Because it does not come because we have chosen not slowly growing photochromosome or catalase resist 68 degrees centigrade. So due to these three factors, this has not appeared in our list. Okay, so if I go to any specific here, then I can see more details which I have already explained to you, phenotypes and everything. You can see the details of it. Now under this mycobacteria again, if I go back, then we have a probability engine. So again in this it's very easy. You can simply type in here and then it gives you yes or no option. If I say yes, I can go by yes, or maybe slow growing, I can say yes or no as per my preferences, and accordingly you will find all the information which is coming here, and then you can build up and see, narrow down which are the most relevant organism or mycobacteria depending on your preferences that you can carry on from here. So it has factor on growth, then say it's not growing here, and you have other characteristics like iron uptake, niacin accumulates, and in enzymatic information we have catalase, so we can say yes or yes like this, and then we can have all these information available. Similarly, we have why not option in this as well. Okay, that's about lab. Quickly we will go to diagnose. As we have seen, probability engine and step-by-step interactive guide in this lab feature. Similarly, we have for diagnose, so which gives us a differential diagnosis. So let's start with the classic version here. So you can put any clinical symptoms here, like maybe fever. So the moment I choose fever, then it starts appearing the list and appropriate. So now you can add further more symptoms or clinical findings which you have cough like this. So it will suggest based on these basic clinical conditions what else you can add. So moment you take your cursor over any of the condition, it will give you the description and the images of chest X-rays involved. So like if I choose pneumonia or lung infiltrate, yes. Then if you have any laboratory findings, you can add various hematological, urinary tract informations, CSF information like this. But if in case you don't have at this moment any clinical or laboratory finding, you can simply say no. And then it gives you information whether what sign and symptoms you put in, it is in relation or context to the geographical location. So you can add country here, like, so I'm adding India because I'm trying to find information on India, and you can choose the age of the patient, like 13 to 60. You can choose when the exposure has begun, and then of course you can have exposure ended or disease onset like this, whether it is a prolonged or recurrent. So I can choose no. And based on all the inputs which we gave here, it will suggest the probability of the diagnosis here. So like 80% is COVID-19, then we have 16% of pneumonia or bacterial infection, then we have influenza, like that. And as I showed why not option in the lab, we have similarly why not option here. It has one more option, which is first case scenario. So it's not necessary that patient who comes to you in India, probably that condition exists. It could be very first case for India. So that's why it's very important to have such kind of resources. So you can see whether globally any such cases has come, or whether it is a, so these are like 25 diseases which could be the first case for India as such. So where you can see the sign and symptoms of these diseases when you go into this. Also, you are able to see this new thing which we have introduced in Gideon, which is this bioterror note. So if there is any causative organism which can cause this bioterror kind of thing, you can have a detailed information on this as well. This particular icon will appear on your screen. So that's how you can see the various differential diagnoses. And another important thing is whatever we have chosen here, and if you go to interactive, all the things which we have used in classic will by default come under interactive also. So you can see here still the differential diagnosis is the same, because it automatically picks up the things what we have entered in classic versions. And otherwise you can also choose like this in it, and you can go to next steps. You can fill in all the details, and then again it will suggest you the differential diagnosis. Very quickly, I would like to show you here the quantify options. So here you can compare data and trends between two diseases amongst the country. So like here, let's take COVID as an example. If I want to see COVID-19 in various countries, so maybe for example United States, or let's take some our neighboring countries, maybe Sri Lanka or maybe Bangladesh. Okay, and now we want to compare the situation of COVID-19 in United States, Sri Lanka, Bangladesh, and of course we need to add our country if we are interested in it. So I have added 4 countries here. So what kind of information or charts you can get from here? You can get charts on cases, rates, deaths, vaccine coverage. And so like here, if we are interested in COVID-19 cases across, so we can add this to chart, or we can have a very quick filter here like cases, so that it is easy to find out. So I have chosen Bangladesh case, then COVID-19 India cases, and then similarly for Sri Lanka and United States. So I can choose these various parameters here, and you can generate the charts. So you can see here how is it from starting from 2019 to 21, how is being the statistics. If you want in a graphical representation, you can use this directly or by downloading this option, or you can simply go to data table to see the statistics like this with all the countries. So it's quite useful in terms when epidemiologists want to understand various statistics. Certainly this is go-to resource for you. Very quickly, I will come to this compare section. I have added some already added some examples here so that I can quickly show you. So in the diseases here, you can add some more diseases by simply putting a keywords and searching for it. Here I have done under the disease, I have added 2 diseases, yellow fever and tuberculosis. So you can easily see what are the differences between them. You can see the differences on clinical finding, as well as you can also have see the differences on the fingerprint side, like agent reservoir, the way we have searched in the beginning. And it talks about the major highlights of yellow fevers and tuberculosis. Similarly, in clinical findings, you will have various clinical findings, and whether it happens very rarely, often, usually, always, or never. That comparison can easily be seen here. Similarly, for the drugs, here I have added 5 drugs, basically cefepime, ceprium, and cefotozolone, and tazobactam, basically kanamycin and gentamicin. So you can easily see which drug is effective on which class of spectrum. Here you can easily see and compare, and then it will help you to identify which is the best for your patient. Similarly, we can add bacteria, like here I have added these two. You can see basics test, journal test, and comparison amongst it. Similarly, mycobacteria and also yeast and algae. There is an option like you want to see only distinguished characteristics, or you want to see the phenotypes. That slider will help you out in your decision. In this, there are certain more options are there. Like if you go to updates, you are able to see latest updates, what happened in it in last 48 hours. So you can see these are the topics which are updated in last 48 hours. And if you want to see any disease or country specific, you can also use that option. You can filter it out by this. Diseases, country nodes, drugs, what is being updated. You can search from this, like disease graphs, which disease graphs are updated. So you can see here these disease graphs is updated. If you are interested in seeing the updates from outbreak maps, then certainly it will show you which is the outbreak, which are the new updates happening here. And you can actually zoom out, zoom in and zoom out also. And then you can see the content by numbers, like what exactly Gideon covers. You can see here we have more than 268,000 results as a references, surveys, outbreaks, graphs, vaccines, bacteria, positive organism, algae, 235 countries data you will get here. And very interesting, you will find ebooks also. So let me very quickly show you that one. So if you go to ebook sections here, Gideon has very special ebooks, which is country specific, which is disease specific, and there are certain guidelines also available. So like if you want to see something related to India, I'm just showing India, but you can select any country. So the sorry. Okay, so I think this is infectious diseases of India. Similarly, we have for everything, everywhere, for every country. So let me. So you can read from here for any country, simply just click on read and you are able to read from here. And if you go to diseases, so like if I see tuberculosis global status, then I can select from there, and I think my screen, something wrong with my internet speed, that's why it's a little slow. Okay, so you can actually choose a global status on any specific conditions here, disease, and similarly, there are some guidelines available like Gideon Guide to Cross-Border Infections, or Important Bacteria, Eastern Algae, or Guide to Surveys, like that. So you can actually read all these books on this Gideon platform. So I think more or less we have covered. Very quickly, just I will show you this. Another thing, dark mode. So if you are reading at night, so it provides you options to put a light mode or a dark mode that you can make changes, and you can go from here. So I think that would be all from my side. I think it's very useful in the sense where you can find out all the information about infectious disease, about epidemiology of a disease at one place, and it is very your go-to resource for any kind of information pertaining to infectious disease or clinical findings on the disease, and maybe epidemiology aspects of the condition in any country specific data you want. You then definitely look forward to Gideon on that. So thank you so much. That would be all from my side. Now over to Remia.
Yeah, so thank you, Rajiv. Thank you so much for wonderfully demonstrating our product, Gideon, which is actual go-to-go resource of the infectious diseases as well as the clinical findings. I'd really like to thank Chairperson Dr. Ranjit Guha Our speakers, HOD Microbiology, Dr. Namrata Kumari, HOD Community Medicine, Dr. Sanjay Kumar, HOD Pulmonary Medicine, Dr. Manish Shankar of IGIMS, as well as our chief guest, Dr. N.R. Biswas. And lastly, I would really like to thank all the wonderful audience to be part of this KnowledgeEdge webinar. Have a great evening. Thank you so much.
Thank you.
Thank you, everyone.
Thank you.
Thank you, everyone.